I'm very optimistic about our future, and I think the future is in coming together in communities with like-minded people
Right.
and, creating a future that we could believe in is sustainable and is, filled with love for all of us and help.
We are absolutely delighted, honored, privileged, and so happy to have Dr. Mike Sinel all the way from Los Angeles talking to us today. Actually, it's the most chilled out conversation we're about to have because he is horizontal. He's lying down. And I'm in my hoodie, so at least you're in your hoodie, so
I'm ready. Yes.
yeah, there you go. So life's good, but Mike, it's a real pleasure to have you on board. Tell us a little bit about yourself, just to set the context, and then we can move it forward.
Sure, sure. And very grateful to be part of Voices of the Future. I'm blessed to know you, Tariq. A little bit about myself, medical doctor for many years, retired during COVID and, taught in the medical school at UCLA as an assistant professor for 30 years or so, and was in the field of spine, and have been on a lifelong journey of exploration of seeking and consciousness, spirituality, longevity, community. I'm in a vibrant community in Los Angeles and recently got to spend time in a vibrant community in Dubai, and into all sorts of things these days, from advising a number of founders have many who are friends who I've invested in, who are doing game-changing stuff in a number of areas, and have my own encapsulated medical foods company, excited to help bring that whole category of natural medicines to the world. And quite a bit.
So that's amazing, Mike. But when I put my little kaleidoscope on and I look at you, I see many new elements coming through and emerging from there. And so to me, you have so many dimensions. I just wanted to understand and share what's exciting you at the moment, what's your passion at the moment, and how it's impacting us in the world.
I guess putting most of my energy and most excited to bring encapsulated medical foods, which in the United States are natural molecules that fall between pharmaceuticals and supplements, but have really strong clinical data and just tremendous safety and efficacy to combat many of the most common ailments, from chronic pain and inflammation to sleep disorders to cognitive decline and fatigue, et cetera. And I took a company that was prescription only, and now trying to go at it and spread it out to the world through international partnerships, as well as going through practitioner markets in the US.
So are you working through pharma or through distributors? What's your international model as you expand?
Yeah, so my international model is wide open to do both, right? So yes, definitely looking to work with international distributors. I think pharma obviously will have great interest in us as we expand and impact significant patient populations. But right now, looking more for international distribution models and potentially direct-to-consumer models in some countries that's more apt for.
Let's look at one area that you are keen to develop, and when we sat, we had a conversation about that, and that's longevity, close to many people's hearts. And as things are developing, we see, and you're dead in the middle of a lot of research and activities going on at Stanford and various other places on the West Coast. What is your view of longevity, and how does it all come together, and how does it come to us as normal human beings?
Sure. I mean, there's a complete paradigm shift in what was called aging, right? Like the other side of that, I guess, is longevity, in the sense that we're really seeing aging now as a disease and coming to understand it deeply in terms of the biochemistry and a number of other factors that play into it that are potentially reversible to a great degree. I mean, I just had a birthday and feel 30 years younger than my age, and getting stronger and more alert, and been deep in the biohacking space. So I look at longevity as we're learning more, and it's still in its infancy, the field, but there are certain things that are really showing up to be very significant. So one thing that's clear is people are dying. I mean, the main diseases are lifestyle diseases like heart disease and cancer, right? And we're seeing now that these things can be prevented to a great degree and put off to a great degree. So I think to some degree, longevity or relative longevity as compared to aging and dying from some of these chronic diseases is accessible to everyone, because we're seeing the role of lifestyle. So things like exercise is critical, and nutrition is critical, and good sleep is critical. And then what I've seen very, very clearly is mindset, because we have a mental health crisis with rising rates of anxiety and depression. I've seen that mindset and using tools like meditation and yoga and breath work and mindfulness type tools and being in nature are critical, and having love and community. And I'd say those are the things accessible to everyone, that if people really worked with the lifestyle things, they greatly increase their life and health span.
Yes, I mean, the mortality age on average is around 80 globally at this point in time. Everything I see and hear about, it is very likely to go up to 100 or maybe even 120 in the next 25 years. How do you think that's going to change the world? Because the population is growing. Will our brains remain as alert and active? And my mom, she passed away a couple of years ago, and she was getting into the first stages of dementia. I don't want to live to 120 and I have dementia at 85. What are we doing for our brain health?
Yeah, so that's a great point. So we're finding out that dementia, like other just like heart disease and cancer, right? These are pretty much, as we're seeing more, very much lifestyle diseases to a great degree. I mean, lots of information unfolding, like insulin resistance is playing a role in everything, and inflammation, which is accelerating dementia. So when I talk about our lifespan extending, we think about well span, right? Because yes, we don't want to keep people alive on machines and with not an intact mind. But I'm talking now about us hiking and having vibrant lives in our 120s and 130s as I see within our lifetimes. And I've told you that I'm very, very excited about that. So with a good, strong, active mind, that again, we're learning more about having a lot of the problems came from processed foods, insulin resistance, obesity, lifestyle, etc. And then we're having interventions as we're improving with that.
Yeah. I know that you're doing a lot of personal biohacking and so on. Can you share some of the elements and what we are likely to see as we go forward?
Sure. I mean, well, I take a number of, I'm a bit experimental. So there's the lifestyle part that I am an avid exerciser. I'm in nature a lot, right? I eat very well. I try to intermittent fast and do some more than intermittent fasting here and there. Get good sleep, etc. But I also take, I'm on rapamycin now, acarbose, metformin. I use ice baths regularly. I do infrared sauna regularly. I am blessed to have a great community and a lot of love and be passionate about my work, and have a lot of young people in my life that keep me young and excited.
That's great. Can we go into the science of this? That's more a lifestyle issue, but what's the science behind it in terms of our longevity as we see it?
Sure. So okay, so in the last couple of years, I've dove into exosomes as an example, which are the signaling molecules. Like most people have heard of stem cells now. So exosomes are secreted off stem cells and carry the translational material, microRNA, RNA, and don't have a nucleus, but have all the growth factors, messenger RNA, microRNA, growth factors. And there's a lot of work being done. I've utilized exosomes myself to regenerate and signal the body to regenerate cells from just like stem cells. And using fetal exosomes, which are now in an experimental phase in the US. There's a study where they're going to be put, I told you a friend of mine is going to be leading this study, to reverse the biological clock of aging by putting exosomes in the hypothalamus through focused ultrasound. And the animal studies are quite excited, and that's an area that I'm super excited about. You know, lots happening with peptides, lots happening with these different drugs, but I give no medical advice, and I encourage people to, you know, consult their physicians.
Yes, indeed. You know, Mike, I am very skeptical about big pharma because, you know, they're sitting with around 1,700 lobbyists in the U.S. Congress, and sadly, they keep the prices of medicine extremely high in the US, but the rest of the world is different. Mike, the lead up to the question really is that I guess if people live longer, pharma makes more money, so they're not going to buy you and close it down. They're going to perhaps look at you and sort of say, hang on, this is a good path to wellness and preventive healthcare rather than only curative healthcare. Because curative healthcare, or sick care, as I would refer to, is where they make the money. So they'll follow the money. So how does this thing square up with the more capitalistic desires and direction of big pharma versus what you are trying to achieve on a more holistic basis?
Yeah, you're very accurate there. You know, pharma's been a reactive disease model, and it's a great business if they keep you on an antihypertensive for 60 years, right? So
Exactly.
And now if we as consumers are focused on prevention and wellness, we should use much less drugs, right? And what I think is happening is pharma is going to come into consumer health, right? So they're coming into nutrition, medical foods as an arena. You know, you can't get patents, but they'll try to control the consumers. But I don't think they're going to have much of a choice ultimately, but to really, you know, respond to what's going to be a dramatic shift in the old disease model into the health model. They will be deeply in the space of biologics and, you know, obviously genetic engineering. So there will continue to be innovations in that regard that they will probably.
Let's pivot slightly from there. Apple is on record, Tim Cook, their CEO, saying that that Apple will lead in personal healthcare over the next 5 years or so, and I think they're probably going to get there. Now, they'll obviously have wearables and product like that, but I dare say you would be an amazing partner for them, reaching 1 billion people or 2 billion people who are using an iPhone today as the packaged product, whether they buy Roblox or they buy Peloton and so on, and they start building it back into what they call a rundle, which is a recurring revenue bundle of Apple. So you just pay $1,000 a month and you get a whole bunch of things, including your supplements.
Right.
Is big tech the direction rather than big pharma?
Yes, I believe so. I think it will be tech and consumer health and well tech, right? That's the word. So I think that's where it's going to shift. I think, you know, we have an information age now where the consumer's going to see things, and we have great people out there spreading the words, right? The Peter Attias and David Sinclairs and the Hubermans of the world, and yourself really, about what's available to people, and models and influencers who are going to lead that charge. So I do think it's going to be well tech and consumer led and tech. And Apple, thank you for the Apple Watch that will tell us how much exercise we're getting, the Aura Ring, how our sleep is, et cetera.
Absolutely. So just a few more personal questions to humanize this conversation. What sort of people do you normally deal with in terms of helping out while developing your products and your services? Technology people, are they business people, are they actors and actresses? You're living in LA, so I dare
Yeah,
say
I'm
you know
living
a
in
few of
LA,
those.
and yeah, I'm blessed to have a lot of a lot of tech innovators and brilliant digital marketers in my close community, and just really mission-driven, conscious, forward thinkers that care about helping the world. And it's a very interesting shift and it wasn't my whole life. I came from a bit of survival, but to now see a place in the world as we're here to serve the greater good, and we're part of something bigger than ourselves. So I fortunately have curated and I'm around a lot of community who thinks like that. And we, like our mutual friend James says, keep your eyes open for the others, right? Because we tend to gravitate together and want to make change.
Indeed. I am a genuine believer that trust is at an absolute premium in the world today, very closely followed by truth and ethics. What is your view on trust, truth, ethics, values in terms of shaping our world, shaping your industry as we look forward?
Yeah, I mean, I think it's critical. I think clearly the public has become disillusioned by pharma over the years because they have sold us to some degree this disease model. And listen, the medical school curriculum, and I trained, is 35 years outdated. I told you this, it's archaic, right? There's
Yeah.
no nutrition and people aren't talking about lifestyle. And it's shifting, but I'm optimistic, and I think trust is critical. And I think because we can disseminate information rapidly and globally, and because people are learning more about sensing energy, that that authenticity will lead the future of what people follow. The influencers will be the ones who are authentic leaders and model themselves and have the communities that model it.
And that's a lovely segue into my next question in terms of authenticity. Can you share a spectacular failure that you had in your life, and what did you learn from it, and how do you see that projecting into the future as a message for the future?
Wow, there's so many spectacular failures. uh, it's very interesting. And again, I'll start off with the premise that every failure is an opportunity. And
Yeah.
my greatest growth has definitely come from my deepest suffering. And
Yeah.
when we suffer through a failure, then we could either shrivel up or ask ourselves, what were the lessons?
Yeah.
So I will say, for me, one of the greatest failures has been choosing wrong people to work with without without being really aligned with what the motivations were. So I've done things in business that I thought were a great business deal and didn't look at the soul of the human I was dealing with, and ended up getting caught up in their evil ways, and that cost me like tremendous trauma in my life. But the wake up of it was, I'm responsible and I co-created it, because I was turning my eyes to the soul of that person and not acknowledging that, and not aligned with myself. So I think being loyal to one's soul is something we cultivate more and more over time, and that will guide us the best in the energy of our body and our breath. And when we connect with other humans, the authenticity will show up if we're honest with ourselves.
Amazing. What's your advice to the young generations that are coming up now? The Gen Zs, for example, born after 1996, they'll live to 120 plus, so they got 100 years to go. How do they shape their lives? What's your advice to them?
Yeah, I was with my daughter a couple of days ago, who's 20 and a sophomore in college, and I was I, I was glad to see the advice she had learned, the advice I would give to young people, which is, you become a reflection of the people you surround yourself with. And I think it's very, very important to recognize that creating relationships and sharing human relationships is the core of life to a great degree, as love is the core of life. And if you have good relationships, as my gardener does, as my pool man does, you will live a happy life and find what you love to do and stay connected to nature and be aware of your health and listen to your body and have people who will hold you accountable to being happy and following your path.
Sounds amazing advice. Now, if you were to put a message in a bottle and then put it out into the ocean, and we find it 10 years later, what would that message be? What would you like people to hear? Your voice into the future, because that's the thesis of this program, is that people like yourselves are very, you can think beyond, the logical time in front of you. So what would be that message in a bottle that we will find, say, in 10 years' time?
Okay, so there's all, at some level, we are energy and we're all part of one, right? Like Einstein said, our greatest suffering comes from the illusion of separateness. And I will take no credit for the statement, but I've come to learn we are one, and we are here to spread light. And if we listen to our souls and are loyal to our souls and associate with people who, use a word, vibe high and vibe with us, we will probably be following a good path in life. And when we hit walls and adversity, trust that that's the unfolding and there's lessons in it. So all the pain is just opportunities, and everything always changes.
What an amazing message. Thank you for that. Anything that I may have missed, Mike, that you'd like to share, or any idea, any thoughts, anything at all?
I mean, I'm very optimistic about our future, and I think the future is in coming together in communities with like-minded people,
Right.
and creating a future that we could believe in is sustainable and is filled with love for all of us and help.
Amazing. Thank you very much indeed, Dr. Mike Sinel, all the way from LA, doctor, creator, evangelist. You've got everything going for you. Doc, it's a real pleasure to be connected to you and to be part of your circle, and hopefully inner circle, as we develop together into the future. Thank you very much indeed for being here and for being on Voices of the Future.
Thank you. I'm grateful and blessed for a great future of friendship together.
I look forward to it. Thank you. Thank you very much.